Hi, I'm Michelle Perro, and I have a practice in Fairfax. By training, I'm a pediatrician, pediatric emergency physician, and of the past 12 years, a homeopath. I, too, am old like Mirto. I finished my residency in 1985 at Bellevue, NYU in New York City, and I went on from there. And after doing my stint in the emergency room, I'm going to leave that ER yoga slide up there. I like it. I sort of started coming out of Western medicine because I was really tired of the Band-Aid approach, and I figured I needed something more, and I knew it, and Western medicine was really restraining me from doing what I needed to do. Western medicine weren't big fans of homeopathy, and I started getting my wings cut a bit, and I decided I needed to fly a bit more, and hence I landed in Fairfax. It's a perfect place for flight, and started my own practice. So I'm going to talk about the thyroid. When I was putting this talk together on this past few weeks, normally when I'm trained to do a talk, and as from med school, I've done lots of teaching, lots of medical students, lots of residents. I would go to my usual sources of information, you know, PubMed, Grateful Med, all the usual sources where I look for, you know, the recent literature, recent studies. And my regular sources of medical information no longer tell me how to practice anymore. And I really learned, preparing for the thyroid talk, that I can't use Western medicine anymore the way I used to. I really have to go outside the box to figure out how to treat my patients, how to treat the community. And so it was a real, kind of almost a sad eye-opener preparing the thyroid talk to realize that I'm really doing very little of what I was trained to do, and that's how far outside of the box I've been thinking lately. And as I go through the thyroid today, I'll explain some of that to you. So what does the thyroid do? The thyroid produces hormones. I'm going to show you a picture of it in a minute. It produces thyroxine. Actually, it produces not but thyroxine T4 is not the T3, but T4, and calcitonin. And what does the thyroid do? It's an enormously important gland. It stimulates metabolism, body heat production, and bone growth. There are these other little glands that sit on your thyroid called parathyroid glands as well. And what they do is they regulate the use of calcium and phosphorus in their body. And I'm not going to concentrate on the parathyroids today. I'm going to really just talk about the thyroid hormone. So there it is. There's your thyroid gland. It sits right where everybody's touching, just thinking about it. That's where it sits. And you know, if your doctor, when you go see your regular doctor for your checkup, if she or he are not actually putting their hands on your neck, and it looks like they're going to get you in a strangle position, they have not examined your thyroid adequately. Sometimes with kids, I'll start in the front because they don't really like you putting your hands in the choke position. But yet you really need to put your hands behind the neck to feel the thyroid and have the patient swallow. The thyroid is actually adhered to the trachea, and it moves with swallowing. It's really pretty easy to sense when the thyroid is enlarged, and that's called a goiter. Thyroid nodules, which are something I'll talk a little bit about, are harder to feel on the thyroid. It's not always so easy. It takes a fair amount of clinical experience to get a good thyroid exam. I just love ghoul school pictures. You're going to have to come with me with my sense of humor. I apologize for the sake of all of you, but here we go. This is what, when you do a dissection of the thyroid, you take away the sternothyroid muscle, and there's the gland, and it's really a small little guy. It's really quite tiny, and it sits right above the trachea, as you can see. With the two vagus nerves, the vagi nerves coming down, those are key nerves, by the way, that come down right next to it. So when I was learning about the thyroid in medical school, I was always pretty horrified about the thyroid. The thyroid was scary. Why? Because it's so complicated. And I thought endocrinologists, the people who treat thyroid disorders and the other endocrine disorders that Mirto and Morgan are going to be speaking about, were some of the smartest people I ever met. Because the thyroid system, it works on a system from the brain, from the hypothalamus, which releases a hormone, thyroid releasing hormone, which stimulates the pituitary to release thyroid stimulating hormone, TSH, which then targets the thyroid gland to produce thyroid hormone. It's a complex system of releasing hormones. The thyroid gland does not release hormones itself without a little knock on the door from the pituitary, which gets a little knock on the door from the hypothalamus. So it's a complex system of feedback, just both positive and negative feedback. The thyroid gland is told by the pituitary, which sits in your brain, in a little saddle, like, hey, release some thyroid stimulating hormone to the thyroid, and then hormones are produced, mostly T4, which then goes to the liver. You need a highly healthy functioning liver to convert T4 into T3, which is the metabolically active thyroid hormone. And then we get what we talked about earlier, increased metabolism, growth and development, and increased catecholamine effect, and that's talking about epinephrine and what Myrto was referring to. And then it feeds back up. So it's a complicated system of feedback mechanisms. So if there are thyroid issues, it may not always be at the thyroid gland where you're having problems. It could be up above or below in your liver. It just depends. So that's kind of a key part of when we think about thyroid hormone. So what does your doctor do if you have a thyroid issue? They order a thyroid panel. They do TFTs, thyroid function test, and classically now, basically, your doctor will order two, something called the thyroid stimulating hormone, TSH, and some aspect of T4, free T4. There are about 15 thyroid tests, and I can't interpret them all. They are very complicated. There are all sorts of indices and free and non-free and bound and non-bound and thyroid binding globulin, and it gets a little bit complicated. But if your doctor is simple like me, we order a basic panel. But unfortunately, that basic panel doesn't tell the whole story. It's really a small window into the function of your thyroid. You need to look at some other proteins produced by the thyroid. You need to look at thyroid antibodies. So what your doctor might be doing when they just order those two blood tests is likely not enough to tell the whole thyroid story. So I'm a big believer you need more of a thyroid evaluation than you're likely going to get. That's one of the first things I do if I see a patient. They'll often come in for a second opinion and they show me their thyroid test and I say, not enough. We need a few more things to say, yes, it's not a problem of your thyroid gland. So, I think about whenever I get emails from our MAS group, Moms Advocating Sustainability, one of our co-chairs, Debbie's a lawyer, and she sends like these massive amounts of literature that I can't interpret. I don't speak lawyer. I don't speak legal. I see too many therefores and clauses, and I get like palpitations. And I'll have to go see Myrto to convert me. But I like chemistry. It's beautiful. Science is so beautiful. This is T4. There's tyrosine. It's an amino acid. We have 22 of them in our body. It's bound to 4 iodines. I'm going to show you what that looks like on the periodic table. So beautiful, so simple. And this, all vertebrates need this. If you're a vertebrate, you have thyroid hormone. We can't live without it. And as a matter of fact, when we came out of the sea a gazillion years ago, we didn't need a thyroid gland because we had free iodine in our bodies. And then the body, over time, over millions of years, created this little gland so we can make the transition from the sea to land, and that's where our iodine is concentrated. We can't live without iodine. It is a key mineral in our function. And maybe I'll talk about that a little bit. So that's what T4 looks like, and there's the mystery.